The Transitional Pain Service is a group of couple of physicians, anesthesiologists at the South Health campus right now, a nurse practitioner, a social worker, and a psychologist. And we are a group of people who are basically interested in easing the transition for people who have complex pain or are at risk for developing complex pain after their surgeries through that perioperative time, and making sure that nobody falls through the cracks and no important balls are dropped. And so our main kind of focus areas are people who have pre-existent chronic pain and now they're going to have acute chronic pain with their surgery, or people that have a very painful presentation and also have risk factors for developing persistent post-operative pain.
This really identifies a gap in care for patients because we have acute pain services which really focus in on the in-hospital care of the patient that's struggling with their pain. And then we have the chronic pain service which really looks and focuses in on patients after they've had pain for a prolonged period of time. And I thought this would be a nice thing that we could do here, and really felt this push internally to see if I could structure something, gather a team that would be willing to work with me and provide the service to the patients at our hospital.
I met with Dr. Raj Kumar and I was scheduled to have a hysterectomy. And I have advanced endometriosis, which has been very debilitating for many years. And one of the things that needed to happen in order to deal with my endometriosis was to have a hysterectomy. So I ended up having the surgery, but in that whole process he recognized that the Transition Pain Services would be a good referral for me. And then I very fortunately was connected with Dr. Jennifer Yeo, who is a godsend. And so she and her team have been phenomenal. I just feel like I've received just such stellar support.
I am friends with one of the nurse practitioners in here, and she actually told me a few of the options available for pain, and she was trying to get me in here. But in the meantime, my pain got so excruciating that I had to see a gynecologist. When I saw her, she was the one who actually officially connected me with Transitional Pain Clinic. How I was managing is like on the go, okay, my pain's here, I should take something. And then I was not taking in between when I'm not in pain. But when I got connected with here and with the Transitional Pain Clinic, they told me to take it round the clock, at least Tylenol round the clock, and then narcotics as needed. And that's what I did. And the other main important key was that I had attended a class, Alicia. She was the one who did the mindfulness class, and I enjoyed it so much. And I think that is one of the class that helped me a lot in knowing that how negativity of the pain is affecting my pain levels.
I found the Alberta Health Services administrative staff here at the South Health campus very open and receptive to the idea of doing something innovative, something different that would impact a patient's experience for the better and make them feel that they weren't just a number, that they were someone important, that they were cared for.
I've helped with the thinking about the program in terms of how are we going to identify patients at risk, how are we going to be able to provide a service to them when we have fairly limited psychosocial resources, and how do we think about evaluation over the long term, and how do we embed this into our busy clinical practice. And I also worked with the social worker, Alicia, around what kind of service and how can we integrate, how can we provide some psychosocial services to patients who come through this program.
I've had a wonderful experience here. As I said, Dr. Stephan is incredibly knowledgeable, incredibly intuitive. There have been times where I've come to his office expecting to just have a simple prescription written and us to go over what's happened throughout the last couple weeks and just kind of move on, and he would say, I think there's something else that you need to talk to me about. And I, start to tear up a little bit, and I would be able to tell him, there is there's something more going on. And he would listen to me, and he would help me through it. And he would help me understand that these feelings that I had are completely normal, and they are justified. And he would help me experience my life in a positive way. And he has been such an incredible help and such an incredible support through this last year as I have faced my pain and faced my surgery. And he has congratulated me as I have gone through different changes and different medications, and he's just really stood by my side. He has been an incredible support, and I'm so grateful for him.